This question is for Vanessa. Vanessa, talking about self-esteem earlier and comparison, I wanted to know your thoughts. Have you seen any studies? Is it more, have you seen it, problems with it more in only children? Like my son's an only child, and I feel as though that's what he suffers from, even though we've always been encouraging parents, like, where does he get this?
Suffers from being an only child?
No, from low self-esteem.
He suffers from low self-esteem. Why do you think it's from being an only child?
Well, I'm just wondering.
Yeah. I think that the way I would like to answer that is for us to kind of go back to the possibility that your son may be quite sensitive and take things to heart and personalize things where others may not, or where one may think, why would you want to personalize that? And that's due to temperament. It's beautiful to be sensitive, but you gotta know how to manage it so it doesn't make you sad all the time because you take everything to heart. My recommendation, and I see a lot of children like that, or adolescents or adults, is really to accept that about yourself, because that may be part, it may not be just with being an only child, it may be with many things he feels oversensitive or personalizes or overanalyzes, and how is that related to me, is to really work on self-acceptance and really accepting that you're like that, accepting that you have a tendency to do that, and it's in that acceptance that you learn to manage and control it, not to look at it as something to get rid of. Your son may not even be aware that he has that quality and that that's what's spurring this. It's really to kind of be aware of that quality he has, that there's positives to it, but if you don't know how to manage it, you know, there can be negatives, which is kind of depression and sadness. And it really is in that self-acceptance and embracing our qualities, be they areas that we really love about ourselves or areas like that kind of quirky areas that bother us. That's part of who we are, and to accept that and not look at it as right or wrong, and just learn how to kind of manage it. But I'm not about getting rid of things, like, we don't want you to be that way anymore, stop. Because it's about accepting that that's part of who you are, and that's good. Let's learn how to manage it so we don't end up sad all the time. Like, that's what how I could start.
Right, right. When you were talking about the comparison, I was just wondering if it's because he doesn't have siblings to kind of compare himself to.
Well, there's much research on sibling order, and then you could say that an only child, an oldest child, a youngest child, a middle child, they all got their own issues that could cause symptomatology. So we can't use that because there's so much research on sibling order and the outcomes of that. So every position, either only child, older, middle, youngest, has issues and concerns that come with it. It's really how that person manages that.
Okay, thank you.
My sister, Mrs. Debra, what should you do if like the eldest child and you kind of like feel like the odd one out because like you have like no one to play with and like and you're like the one out like in the school.
So you're the oldest kid?
Yes.
And you're like by many years?
Yeah.
Okay. So what are you looking for someone to play with, or
I'm like the odd one out, and like
you feel like because you're on the older side of things?
Yes.
Yeah. I kind of remember that with my own kids because I have a big gap, but I have one little guy who's 6 and I have somebody who's 15, so there's a lot of years there. You know, I think that maybe it's about you're looking for maybe your mom's time? Is that what maybe that what you would like to have?
No.
Well, you know, I think it's probably a case of you are into some other things because you're older and bigger and you want to do a lot of stuff. And when you got a little person around the house, they're basically like you're in one place. They need to be fed a lot. They need to be changed a lot. So you're kind of at different speeds, right? Because you want to go and do stuff and be places. And it's like stay home with the baby, which can be a little bit dull. So maybe it's about planning things for yourself, or like having something that like you know you're going to do once a week or once a month, something that's really fun. And maybe you say you're not that into being with your mom, but I bet if just the two of you went out and did something that you would probably like that. You know, like maybe mini golf. That's what I would pick. good?
I guess along the lines of what you were saying, being the only child, because he was the only child for so long. One of the things you briefly touched upon was coping skills. How do we get shy, he's shy or self-confident, how do we get him to develop more coping skills to deal with if somebody might say something he don't like? Because he's about to go to middle school, and I keep saying, middle school is going to eat you alive if you don't know how to manage and control yourself now in 5th grade. What are you going to do in 6th, 7th, and 8th grade? And I think of, I tell him I'm going to get him the James Patterson book to help him with that one. But what are some of the things that you could recommend to help him develop coping skills to deal with some of these everyday issues?
Well, so that's actually a very specific question to your son and your family. So it'd be hard to give a broad answer to that. But one of the main things would be, what's your son's first name, if you're comfortable?
Solomon.
Solomon, what a wonderful name. Is if Solomon himself is acknowledging that he's having difficulty coping and that he's not defending, like, there's really like, wow, I really am having difficulty coping. I really would be open to somebody helping me. That would really be a great first step. And typically, we do recommend for many families to come and see us in the behavioral health department for a consultation where we can learn some more specific things about your circumstances and your son, specifically because everybody's an individual. There's different techniques that we do teach for coping for children, but one of the main things is that it's not where this is looked at as a criticism towards him, but more so he can be happier, because if we learn how to cope, right, life is smoother. So there's this wonderful outcome from it. And maybe to kind of spin it that way would make Solomon open to kind of talking with somebody, talking about what's a struggle for him, and really learning some strategies to kind of experiment with, come back, tell us how he did, experiment with, come back and tell us how he did. So that's kind of what my response.
The only thing I would add is middle school is not that bad. There's and maybe you remember your own middle school experience, or maybe you're concerned for him, but a lot of kids worry about the first year of middle school. That's a frequent question again. It's like, oh no, it's middle school. And by and large, most kids, come back and write and say, don't worry about middle school, 3 months into it, and it's fine, and I'm not worried, and I know how to do my locker, and all that sort of stuff. So I think all those things, back to kind of like these achievements, right? So the first month of middle school, getting your schedule down, knowing where to go, knowing, how to open your combination locker, all those things can kind of build confidence rather than tear it down.
I guess we see a lot of, there's a lot of things out there, but one of the things that I do not see addressed is how to give children coping skills to cope with, oh, you're fat, or you're black, or you're short, or you're thin. How do we, as parents, give them those coping skills? Because 10 years from now determines how they cope with life now. What do we give them in addition to what we're giving them now? How do we help them develop those coping skills, and that way they can deal with stressors and not have to break down because somebody says something that you don't like or you think is mean.
Yeah. The first thing that occurs to me is that, especially now, I think kids are a lot better off because bullying is not tolerated as it once might have been. Not that it's always easy and every administrator always makes the right decision, but I think you shouldn't necessarily have to cope with someone criticizing you like that at school, because you can turn to a counselor, you can turn to a teacher, and other kids are, we're trying to empower other kids to say that's not right, because we don't want people to have those experiences. So rather than say, how do you cope with those slings and arrows, let's say you don't have to. Tell someone. Tell me. We'll find some solution and let them know that they don't have to sort of suffer in silence.
And I just have a cute story that dovetails right nicely into that, of this family I saw with this little girl. I think she was about 8, and she was overweight. And so she would be made fun of in school. And I asked her what she did, because she wasn't upset about this. And so she someone would say, you're fat, and she would do this in the bedroom. fat and fabulous. She smiled, and she was just like, it's cool. You know, and her mother was very accepting of her and felt like if that works for you, that's wonderful. And she really moved on. And so that was her own little coping. Now, she's a very laid-back kid. Okay? She doesn't obsess about stuff. Okay? So she has more of an easy temperament, whereas I think if she had more of it, was more sensitive in terms of really taking everything to heart, she may not have been able to do that, so you always have to take temperament into account.
I just had a comment about the concept of only children. I have one child, and I've chosen to refer to her as a single child because only to me denotes sort of a deprivation or a loss or a longing. And a single child actually has lots of opportunities that children with siblings might not have. Just a comment.
Hi, I was just wondering, how do you deal with when you talk about comparisons? And even if the parents are not making comparisons, I have two boys at home, age 10 and 12, and the younger one shines everywhere. He's a good student, he's very good at sports. The older one just doesn't get it as easy. But he, in his own mind, sees it that he tried out for travel soccer, he did not get in, but the younger one did. How do you deal with a situation like that? And also, in the real world, as parents, you want them to succeed academically, you want them to succeed in sports. How do you do it in a more positive way instead of giving them low self-esteem?
Well, to answer the first part of your question, oldest children have somewhat of a unique position in the sense that they really will align with the parents as authority figures. And because they're older, and they know that with being the oldest, such as identifying with parents, that comes with certain increased responsibility, certain authority that the younger siblings don't have simply because of place. They intuitively know this, okay? Because they're older, there should be some privilege. When the younger sibling excels in areas in which our culture deems attractive, sports, academics, that will be very problematic and especially difficult for the older child if they excel in other areas that are not so mainstream or they're not even sure what their talents are. What we typically recommend is to not put siblings with different abilities, for example, athletics, in the same type of sport, that there needs to be some separation. So the younger one is great at soccer, you feel the older one is not, maybe to have him do something completely different that's his own. In order to increase his feelings of self-contentment, you know, really what we do recommend is that he try out different things to find his own unique area in which he can excel. It may not be traditional, what we traditionally look at as wow, but it would be something that he would be really good at, and for you as parents to give the same amount, have the same amount of feeling proud and encouraging him in that.
Regards to my parenting skills, I have a daughter who's 12 and she's very bright and intelligent, and at lunchtime she don't sit with the other kids because she said they're immature, they get on her nerves, so she's always sitting with teachers during her lunch break or at the library, and it's been going on since she's been in elementary school. So I tried to encourage her to sit with her peers, but I don't know if that's good or bad, because she kind of don't want to, and she's like, they're very immature, I don't like middle school anymore because the kids don't act their age. I'm like, no, you don't act your age, you're a little bit older, you act a little bit older than them. So how should I deal with that?
You may not like my answer. You sure you want it?
I want it. That's why I'm here.
Okay. So what I heard is the same. It's a lot of kiddos we see. And what the issue is that adults are much more predictable, okay? They're easier to be with. Okay? They will not mess with you. Okay? They're easier to navigate. It's less socially complex. And they pretty much will accept whatever response you give as long as it's respectful. Yes? So they make you feel really good. Okay? She feels really good around adults, likely because of that. And with peers, peers are not as forgiving. Much more, they're moving quick, one thing to another, you know. She may be, again, very sensitive. Again, she takes things to heart. So it may be where that level of complexity she's not really comfortable with because she has that. Let's say the teachers were not nice. She'd probably hang out with the peers. Do you see what I mean? You got to look at relatives. She's got that. The goods are there. Why wouldn't she want to be with somebody, people who are making her feel good about herself? If those teachers weren't there and there were no other options, she'd probably work harder to get along with the peers.
Hi. How does somebody go about learning how to change their response? Your example earlier, when a child comes home with a disappointment, you had a great response. Oh, that's unfortunate. And, you know, so how do you learn that language? Is there a book I can go to that okay, this sounds great. I'm just kidding.
Sometimes it's actually as simple as that. So you're saying like how do you really feel it, or you just like how do you remember in the moment?
I didn't know what the right answer is. Oh, that's unfortunate, and oh, that happens to everybody. That sounds great. And I'm like, oh, I better remember that one. When it happens, my knee jerk is okay. I remember what my mom said and what my dad, and I didn't like that, so I'm going to say something else. But it's kind of just that.
Right. So, and that, I think that is part of the struggle. I think it takes heroic efforts to do a lot of the things that I think parenting books and seminars suggest. I think it would take a lot of effort. It would take a lot of effort. You'd really have to learn to discipline yourself to either, if that happened and you already started on your typical automatic response, you would either have to stop, you'd have to train yourself, you'd have to stop. You know what, let me start over. And then try this. And then it'll become more natural, but I think it would be hard to implement if you yourself are not sort of compassionate towards yourself when you make mistakes. I think there needs to be modeling. I think there needs to for parents to model for their children what parents are asking sort of their children to model themselves. But I mean, you're on the right track. It is simply a matter of doing it. And you don't really need a manual. I mean, you know what? You can make a ton of mistakes. You can use a lot of leeway as long as your heart and you're on the right track with that. And really what the problem is that sometimes the message children pick up is, you know what, this is really about you. You don't want to be anxious about this anymore. You want me to be okay so then you can feel, I hear that all the time, then you can just feel better. And they pick up that message very subtly. Whereas the communication needs to be more as, this is really not about me. This is about you, okay? And so if you need to be in this place, in other words, it's okay to make mistakes. A lot of parents think, I'm not gonna say that to my child. He's gonna think he's gonna make mistakes left and right. It'll be okay. It doesn't work that way. So you're kind of on the right track, but it is really a matter of, I would say, get a few key phrases to start with, but you don't need to say much. You need to maybe say one sentence and leave a lot of pauses. Let your children come to you. Let them come to you. You rarely need to go after them. Typically, that doesn't work. They need to, if you can say it like, wow, that's really unfortunate, you're done. Let them respond after that. There's really nothing else you would need to say. You've opened the door if they want to step in a way that's very non-judgmental. So you don't need a lot of phrases. It's a lot of reflective listening. That sounds hard. I would have, right. Exactly. Because that's right. Exactly. A lot of reflective listening. You know what? I would have felt the same way. That's a perfect thing to say. I would feel the same way.
I would just add that a lot of kids say that they worry about kind of being upfront with their parents because then maybe it's going to turn out they're going to get in trouble for it, or it's going to be thrown back in their face in some other incident. So that would be the other bit of advice I would give is to not put it in your back pocket and pull it out some other day and then have them feel bad about sharing that with you.
Hi, my 12-year-older, he is sensitive. He also has a weight problem, and there are times where he beats up on himself, especially something happened when my husband said something to him, and then he went off into a corner and he started crying, and he was like, why do I always mess up? Also, as far as the weight problem, in the winter, he was a part of the wrestling team, and they got a sweatshirt. So he's still wearing the sweatshirt because he feels comfortable and it's covering himself. And and I don't know what to do about that.
I mean, I will say that a lot of kids write into us about weight problems, and it's probably like where he is in the arc of acknowledging it, wanting help with it, willing to do the things that it takes to change. And so that would be sort of my first. Yeah, yeah. Well, I do work with a great pediatrician in the weight clinic here at the hospital, and she often talks about, we want kids to exercise, but sometimes what they don't feel comfortable about is not the exercise, but is how they look when they're exercising. So maybe there's, a nice tank top or flowy, athletic t-shirt or something. So maybe it's just that if he felt a little bit better in those things, maybe he would set the sweatshirt aside.
Mainly with the sweatshirt when he goes to school. Like, he doesn't get fearful that the kids will start taking on
Yeah.
something else.
Yeah. Yeah. That's tough. Do you have any?
You could ask him to experiment with some experiment, like a scientific experiment, but at the same time needing to tell him that it could be that people do say something, can you handle it? If you can't right now, that's okay, but we can't predict what people will do. It's about helping the child learn how to think about that or respond to it because it may happen. Not to go to school and hope that it doesn't happen, but that if it did happen, I'd be okay. Here's what I would do.
Test. I think it's on.
Thank you. This is for either one of you or both of you. I was just wondering if there were any studies about children and self-esteem in relation to all the technology that we have now compared to 10 years ago, 15 years ago, even when we were children, which is a long time ago, compared to what these kids have available with the internet, with iPods, with cell phones, with this, with that. My daughter's 11. She does not have a cell phone. She does have a laptop because for school, everything's online. But I guess it's really more of it's just a general question that I have, not anything specific. I was just wondering if there were any studies about that.
Vanessa may be able to answer about studies, but I will tell you there was a recent phenomenon where girls were putting videos of themselves on YouTube and asking people to say, are they good looking or not? And of course, the predictable thing happened where, some people said yes, but lots of people said really mean things. So I think as far as exposure to things that are going to be negative, it's definitely true with technology. Anything to add about research?
I don't think there's definitive research because this is sort of very new and still developing, but it really depends on what outcome you're looking at, like detrimental in what way. And so unless we know what we're trying to prevent, right, like it's unclear that would be detrimental. It seems like it would be, like intuitively, and I think it is if the individual is doing that to the exclusion of other activities. Their grades are failing. They've withdrawn from friends. They're staying in their room all the time. They can't. There's an addictive quality to it. They can't pull themselves away from it. Then that would be problematic. It is difficult. I think there's this, the children want to keep up with each other in terms of technology, and then the parents feel pressured because they don't want their children, to feel like outsiders or alienated. So I think it is a struggle, and it's a fine line, and I guess it's up to every parent individually how they want to handle that. But I think if overall the children are functioning well in many areas, then I think that's indicative it may be okay. Whatever level it's at may be okay.
Yes. What are your what are your thoughts on using the use of a personality assessments to help families, parents, as well as children gain a better understanding of their unique self?
You should ask that. That's actually one of the things I do here at AI, and I think they're very valuable. I think that they help families understand their child or adolescent's perspective and what life is like for that in a way that would take a very, very long time with therapy. And it also helps the adolescent have an understanding of themselves that doesn't include blame or self-criticism, but actually, wow, I have a framework for why I'm like that. I have a framework for why I'm doing the things that I'm doing. And it includes, areas of growth, as well as, real strengths.
I have a question. I have a 4.5-year-old, and I wonder if this is too early to do something about building the self-confidence, self-compassion, possibly doing some behavioral evaluation.
Is it that you think there's a problem?
I don't think there is any major problem, but I have some indication of him occasionally shutting down, for example, at birthday parties, completely not participating. So I can tell he is sensitive and certainly would benefit from boosting his self-esteem.
So the first thing that sort of comes to mind is that I guess your concern about him sort of withdrawing, is it withdrawal where he's different from the way he is in other places, or he's becoming different overall?
He feels quite confident when surrounded by people he knows, including his peers,
right?
But feels completely intimidated by new situations.
So that's actually called something. It's called sort of slow to warm up type of temperament. It's completely normal. He just is a little cautious. That's his style. And I think, I'll be honest, I'm not hearing anything problematic with that. I think it's okay to be that way. Are there some consequences to that? Maybe he won't make as many, he'll have 9 friends instead of 10, okay? But I feel like, again, I'm always gonna go back to self-acceptance and accepting your child for the uniqueness that they have and the tendencies they have. It is only when a behavior or a tendency becomes pervasive, right? In other words, it's taken a life of its own and it's starting to exclude others that there would be cause for concern. But if there's enough variability in activity and affect, then I think that it sounds like I think it sounds like you have some anxiety about what could this mean, because he may not be as social or make enough friends as somebody else. And that's what, success in our society is really got to, networking and getting out there and meeting people, right? If you've got some anxiety or some social withdrawal because, well, it's a little too much, oh my gosh, are you going to meet enough people? You're going to meet the right person. So I think it's a matter of managing some of that anxiety, if I'm accurate here, and really accepting and being respectful of your child's feelings about novel situations, and that I'm not really hearing a problem. I'm hearing maybe a more slow to warm up temperament.
Well, I certainly don't come here from trying to improving him. It is more like I recognize a lot of my own life in him. And I know how many times in my life I was stopped from doing something that I might have done if I had a little bit more confidence. So I'm here just to help him a little bit, possibly push him a little bit not really from my some kind of egoistic or
You know, the thing is that it's actually paradoxical because by pushing the children, they feel that they're flawed and they're actually going to withdraw even further. But it's by accepting that tendency that they have, right, and showing them that you accept it and processing that with them and respecting it and giving them the space that they actually develop confidence in themselves. It actually works the opposite way.
And who better to do that than a parent who understands exactly where they're coming from and can relate really well. So
I actually have not been pushing him at all. I'm just more like, should I be doing that?
So you look.
I mean, I obviously would welcome him to be more forward, more confident, more. He's a lot of a follower, not a leader. He always very competitive. He hates to lose. There are these little indicators that point in the same direction to me.
And so it sounds like he's kind of hard on himself, like he hates to lose. So I mean, maybe you can go back to some of what kind of we talked about with the self-compassion and kind of try that a little bit.
But how do you do it with a 4-year-old or 5-year-old?
You can model it yourself. When there's setbacks for you, you can model it, and that works very, very well.
Thank you.
Okay. I'm keeping an eye on the clock, and I see that we're coming up on 7:30, and I want to be respectful of everybody's time here, who have kids to get home to, and also Vanessa and Debra's time. So if we could take one more question, and then we're going to wrap up, okay?
Hi. I have a 9-year-old, and it's like he takes everything nonchalantly. Correction, if he gets a failing grade, and I'm wondering if that's a problem with self-esteem and self-confidence, or is that just him growing and those are his growing pains?
Well, so that's like sort of a complex situation. I'm going to try and do the best I can with just sort of providing a framework, and that's just based on a lot of the kiddos that I've seen. Typically when I hear that kind of scenario with a child, it says like he takes everything nonchalantly. So he's a more easygoing young man?
All together, from, it doesn't matter what it is. It's not just in school, not doing good in school, but just life altogether, appearance.
So he thinks he's
dressing,
the man.
whatever. He's like, all right.
No?
Well, yeah.
So he thinks he's pretty good.
Yeah, he
So now
just
there's some
doesn't-
positive, I want to tell you the positives to that. Children like that are protected against anxiety and depression. Why? They do not take to heart the corrections that other people give them. They just don't. They're like, yeah, okay, yeah, I'm not, yeah,
laughs.
Yeah. So the problem though, so that's good for them. They're kind of protected against feeling bad about themselves. But they tend then not to learn from feedback.
Mm-hmm.
That's the issue. There's a positive to your son's temperament and disposition, but there's also an area of growth there, which is because they're so laid back, the feedback doesn't get internalized. Whereas, meaning internalized, like I feel a little guilty now. Let me kind of like do what they want me to do. He's so easygoing. He doesn't obsess about things. Doesn't ruminate over and over and over. He just kind of brushes it off. That's a quality many would be envious of. Okay, many would. Your concern is, for his functioning, for his future, for his grades. And so that's really where I want us to, because I think after that there would need to be a lot more to be known. But I hope that may be a bit helpful in terms of a framework.
Concerned about it as far as like his grades and stuff, because I see constant progress in what he does. It's just like if you tell him to do something or you correct him, he's just like, this is him like the whole time.
No, I'm kind of jealous. I gotta be honest. That's right. But yeah, I think you'd have to see developmentally is he kind of on target with most things. Are most things going well for him, or do you feel this tendency is really causing a lot of problems in his life? I mean, that's where you have, it's not just the behavior, it's how is it affecting things? If it's not affecting things negatively, then, that's wonderful.
Wouldn't be a problem with self-esteem and self-confidence at all then.
I'd have to know a lot more. There may be a little defensiveness to him, okay?
Yeah.
Like, I don't want to hear that.
Mhm.
Okay, I don't want to hear negativity about myself because I don't know if I can deal with that. That may be there. So, I mean, really putting some of the self-compassion in place, some of those ideas would be a good thing to experiment with.
Okay. Can everybody join me in thanking Vanessa and Debra one more time with a round of applause?